Welcome to class, students. Today we'll be looking at a very vital topic titled Bleeding and Hemorrhage Control. How do you control your bleeding in case you encounter an accident victim or somebody that is bleeding? How do you control it? How do you properly manage it to protect the person or to ensure the safety of the person? Yeah. Introduction. Controlling external bleeding is a critical priority in pre-hospital care, as hemorrhage represents one of the most treatable causes of death in trauma cases. Hemorrhage refers to a blood loss from the circulatory system and can occur either externally through wounds or body opening, or internally within the body. So hemorrhage can occur in two phases: the external one, through the one we can see, the one that is visible to everyone, through wounds or body openings, or internally within the body. The circulatory system contains three primary types of blood vessels. We have the arteries, the veins, and the capillaries. These are the major source of blood vessels. These are the three primary types of blood vessels in the body system. So the arteries, the veins, and the capillaries. The circulatory system, let's also look at the internal bleeding. Internal bleeding commonly affects the stomach, lungs, or bowels. And signs of how will you know, because it's not actually visible to everyone. How will you know somebody is having internal bleeding? We have blood coughed up from the lungs. You see the person coughs and the person coughs out blood. We have blood vomited from the stomach. When the person vomit out blood. When the person coughs out blood. Blood appearing in stool from bowels. When the person defecates, there's blood. You can see blood stain in his stool. Then we have patients with internal bleeding typically display restlessness, weakness, pale skin, taste, and a rapid faint pulse. Those are the symptoms or signs of somebody experiencing internal bleeding. You have the person will be restless, the person will be weak, will have pale skin, taste, and the person will be testing and a rapid faint pulse. If you suspect internal bleeding after an accident, seek immediate medical attention while waiting for help. While waiting for help, you can keep the patient quiet and lying flat. The person should be quiet and lie flat. Then, because being restless actually exaggerates or increases the worsen the case, so the person should keep quiet and lie flat. Ensure they are comfortably warm. Give nothing to drink, not even water. Transport a lying position when moving to medical facilities. When you want to move the person, ensure the person is on a lying position. Symptoms of internal bleeding. Minor internal bleeding often produce only small red specks on the skin or slight bruising. However, severe internal bleeding can become life-threatening, particularly when significant blood volume is lost, leading to hypervolemic or hemorrhagic shock. So, let me repeat that again. Severe internal bleeding can become life-threatening, particularly when significant blood volume is lost, leading to hypovolemic or hemorrhagic shock. Internal bleeding symptoms can vary by location. Intracranial bleeding, that is bleeding inside the skull, typically results from a long-time hypertension, weakening arterial walls. Symptoms may include the following: weakness on one side of the body, one side of the person's body or the victim body will be weak. We have nausea, we have vomiting, we have headache, and changes in mental status of the person. So as these signs, these are the signs you can see from somebody experiencing this internal bleeding. External bleeding, apply a pressure dressing, multiple layers of sterile gauze over the wound, secure it firmly enough to stop bleeding, or maintain pressure with your hand. When possible, elevate the injured areas. So we want to be looking at the difference between the internal and the external bleeding. External bleeding flows outside the body as seen with nosebleeds or minor skin cuts, while internal bleeding occurs inside the body, typically following organ damage or injury to internal structures. Common sites include hip, knee, elbow, ankle joint. Internal bleeding may also affect the brain, large muscle, intestinal tract, or the space around the lungs. Types of bleeding: we have the arterial bleeding, the venous bleeding, the capillary bleeding, pleural cavity bleeding, abdominal bleeding, bleeding from bone fractures, gastrointestinal tract bleeding. The arterial bleeding is the most severe and life-threatening type. Flows rapidly and profusely due to arterial pressure, spot in the rhythm with heartbeat, appears bright red due to high oxygen content, difficult to control and form clots, can result from penetrating injuries, blunt trauma to organs or vessels. And treatment of this arterial bleeding is applying immediate pressure with gloved hands and sterile gas, while calling emergency services, covering with sterile dressing and bandage to maintain pressure if bleeding stops, elevating the injured limb above heart level when appropriate, using tourniquet above the wound as a last resort if other measures fail. So it is a very severe and life-threatening case type. That's the arterial bleeding. The venous bleeding is the easier to control because blood in veins is under less pressure, which facilitates clotting. The blood appears darker red due to its lower oxygen content. Despite being more manageable than arterial bleeding, venous hemorrhage can still lead to dangerous levels of blood loss. While less severe than arterial bleeding, venous bleeding remains potentially life-threatening and requires prompt medical attention. Blood from veins flows steadily rather than forcefully because veins aren't under direct pressure. The dark red indicates lower oxygen content compared with arterial blood. So the difference between the venous blood and the arterial blood is the presence of oxygen. One is darker due to the absence of oxygen, while other due to the abundance of oxygen in the arterial blood, it makes it brighter in color. So dark or red color indicates lower oxygen content compared to the arterial blood, which has bright violet colored. No, treatment for venous bleeding follows the same protocols as for arterial bleeding. We have the capillary bleeding. Yeah, capillary capillary bleeding is the next. Is the most common and easiest type to control since capillaries lie closest to the skin surface. The blood tends to ooze rather than flow or spurt due to the very low pressure within the capillaries. The type of bleeding typically results from skin injuries and occurs more frequently than other bleeding types. Instead of spurting like arterial or flowing like venous, the blood simply oozes from the damaged area. Capillary bleeding represents the least severe form and is the most manageable because it originates from the surface blood vessel rather than deeper body structures. The pleural cavity blood the pleural cavity bleeding in the pleural cavity, the space surrounding the lungs interferes with normal lung expansion, controlling the exchange of oxygen and carbon dioxide between lungs and bloodstream. Symptoms of the pleural cavity bleeding cause chest pain, shortness of breath and dizziness. We have the abdominal bleeding. This refers to an hemorrhage within the large intestinal activity containing organs like the stomach, liver and kidneys. Common causes include the damage to the liver, kidney or spleen, blood vessels damage in the abdomen and ruptured cysts. We have emergency treatment guideline. Perform primary assessment following the DRSABCD protocol. That is danger response stand for help, airway breathing, CPR, defibrillation, depilation and control major bleeding. Ensure emergency medical service are en route. Check for foreign bodies in the wound before applying direct pressure. That is very important. Apply direct pressure to the wound. Elevate the injured area when possible. Place unconscious patient with adequate breathing in the recovery position. Conduct secondary survey. Be prepared to administer life support CPR for severe bleeding that leads to unconsciousness. Keep the patient at rest and provide reassurance. Thank you for listening.